So let me start by saying that there is no evidence that a sugar-free diet will prevent you from getting cancer. There is also no evidence that eating a sugar-free diet will heal you from cancer. So I think it's important to say that very clearly. Now, people might say, so what's all the fuss about it, right? If it doesn't heal me from cancer, if it doesn't prevent me from cancer, why do we even talk about this? Well, there are several crucial indirect links between sugar and cancer that is very important for you to understand, and that doesn't have an impact on cancer occurrence and also on cancer recurrence. So I wanted to go through these 5 links with you. So first of all, it's really important to understand that sugar consumption has been always and again linked to higher rates of obesity and overweight. And when we talk about obesity and overweight, it's also very important to understand that that is a higher risk factor for cancer. So if you are overweight or obese, your risk of cancer just increases. And there are countless studies who have correlated, higher consumption of sugar to obesity. And this is really important to understand because it increases your risk of endometrial cancer, breast cancer, ovarian cancer, prostate, liver, gallbladder, kidney, and colon cancer. And specifically, for example, for women, it increases their risk of breast cancer. And multiple studies have also linked higher consumption of sugar and higher adipose fat to higher risk of estrogen receptor positive breast cancers. And in addition to that, it's not only that your risk of cancer for women is higher, but it's also when you are obese or overweight, the risk of mortality of cancer is higher and the risk of recurrence is higher. So there again, we have an important factor, and we talk specifically about the visceral fat that is around our vital organs. And specifically for women, post-menopause, in this visceral fat, there is estrogen that is produced. And higher exposure to estrogen also puts you at higher risk of ovarian and breast cancer. And now you might say it's of course not only sugar that increases your risk of being overweight, but sugar is particularly vicious because it's very addictive. So when we consume sugar, and I'm sure you have noticed it too, when you consume sugar, you kind of always want more. And also because sugar has very low nutrients, it gives us more appetite. So again, a reason to make us overweight. So that's the first link that I wanted to signal. And then the second important link is the correlation between increased sugar consumption and increased blood sugar level and insulin level. So, of course, when you consume a lot of sugar, your blood sugar levels goes higher in your blood. And this, again, puts you of higher risk of cancer. Why? Because first of all, if you have higher sugar in your blood, so hypoglycemia, your risk of diabetes is just so much higher. So diabetes is also linked to higher risk of cancer. And that's one of the reasons that I also always recommend my clients to have their blood test done. And I don't know, if you do your blood test on a regular basis, there is one test that you should actually do, and it's the hemoglobin A1C. And that measures actually your blood levels for the past 3 months. And there you have an indication of where you stand. So if you are higher than 6.4, you have diabetes. But if you are at 5.7 already, you are pre-diabetes. And that's where you really want to intervene. So that's where you really need to start making some changes in your diet. So there are several meta-analyses that have found a correlation between diabetes and certain cancer risk factors, especially pancreatic, endometrial, breast, and colon. And again, if you have diabetes, it is also associated with higher cancer mortality, which is also not to be underestimated. Recent research also shows that hyperglycemia has a negative impact on our DNA. So not only does it disrupt our DNA, but also it prevents our DNA from getting repaired, which we know, again, damage on DNA, causes higher risk of cancer. Hyperglycemia, on the other hand, also promotes insulin resistance. So why is insulin important when we talk about cancer? Because when we have higher levels of insulin in our body, this is a growth factor. So insulin is a growth factor. So you don't want to add more growth factor if you are already going through cancer. Insulin is a hormone, and it's secreted by our pancreas. So the more we consume sugar, the more we are at risk of higher insulin in our blood. And as I said, insulin promotes growth, but also insulin promotes angiogenesis. What is angiogenesis? So it's the growth of new blood vessels around the tumor, which makes it much easier for the tumor to grow, but which also puts you at higher risk of metastasis, mainly of the cancer traveling to other places in your body. So that's my second link to cancer. And then the third link that I wanted to talk about is inflammation. So we know that inflammation is the root cause of many diseases, including cancer. And cancer is an inflammatory disease. If you go through cancer treatment, like for example, chemotherapy or radiotherapy, it adds even more inflammation to your body. So you want to make sure that when you consume foods, that it's not foods that will enhance further that inflammation, which is the case of sugary food. So we know that foods high in sugar would increase inflammation levels in your body. So that's another reason, why you need to be really careful around consuming too much sugar. And you can see in test results, blood test results of people who are consuming high levels of sugar, that their inflammation markers like the C-reactive protein is usually higher. Another important point to understand in terms of inflammation is that when you have higher inflammation in your body, your risk of a cancer recurrence is also higher. Now, the fourth links that I wanted to point out is your gut health. So Hippocrates already said more than 2,500 years ago that every disease begins in the gut. Well, there are more and more studies that also find a correlation between the health of your gut and cancer. And we know, again, that consuming the high sugary food increases the potentiality of having a bad microbiome. So having a good microbiome means that you have a good balance between the good and the bad bacteria. If you eat a lot of sugary food, it decreases your levels of good bacteria, which puts you in a situation of dysbiosis. So your microbiome is not optimal, which makes that your immune system is not optimal, because we know that about more than 70% of our immune system resides in our gut, which is again very important in terms of cancer. But more than that, also there's studies who have found that if you have not a healthy gut biome, it's much more difficult for cancer patients to go through cancer treatments. So people who have a healthy microbiome do better. They have less side effects, they recover better from treatment, and also there has been studies linked to better resistance to immunotherapy, cancer patients doing better. So again, the link between the gut health is really important. An unbalanced gut microbiota has been linked to diabetes, obesity, depression, but also to cancer, specifically colon cancer. And also, what we also need to understand, that there are also certain microbes in our gut that can promote a cancer growth. So that's another reason why diet is so important, and we need to pay attention on the amount of sugar that we are having on a daily basis. The fifth link that I wanted to do is around sleep. So we know, I think that we know now how important sleep is for our overall health and for our immune system. Well, again, consuming high levels of sugar usually impairs our sleep. People who tend to consume a lot of sugar have a lot of cravings. So often they would eat late at night, which will often have an impact on the quality of sleep. But also, if you have blood sugar levels that go like up and down, it tends to wake you up at night. A lot of people that wake up, for example, around 3 a.m., often it has to do with their blood sugar levels. They are not aware of it, but it very often has to do with their blood sugar level. And interrupted sleep, not good quality of sleep, again, puts you at higher risk of any kind of disease, including cancer. So these are the 5 links that I wanted to point out to just, have this clarity around what is it that makes sugar consumption so dangerous, when we talk about cancer.